The one thing good coming out of the hearing, I believe, and I think Dr. Fauci made this point over and over again, we're at a place where we can definitively say we do not know if it was lab or zoonotic from animals. We do a lot of zoonotic work. It's our opportunity to really decide as a global community how we're going to control laboratory experiments in a way that protects the public.
Do you think there is any veracity to some of the Republican accusations that there was an effort to discredit the lab leak theory?
I think early on, people did take very definitive sides. And it did divide along party lines. And we're still suffering from that 4 years later in a whole set of issues related to pandemic and pandemic preparedness.
Sure, but on the lab leak specifically, you think that happened?
I do think it happened. I think people were, if you look at what people said about Bob Redfield and how they disparaged him as a scientist because he wanted to bring forward the lab leak potential. And I think the reason he felt he needed to bring it forward was to push against this, it had to be this way, because we didn't know. And we knew we would never know. I mean, we knew with SARS that China was not transparent. We knew with the second SARS, China was not transparent. So we were not going to get an answer, but that shouldn't have held us back 4.5 years later from both ensuring that we protect against lab leaks and we protect that public. I mean, people got infected with HIV in the lab. It happens. It definitely happens. And so we have to put different rules and regulations and guidelines in place to protect the public. We can do that. We've done that before.
I realize hindsight is 2020, and you and everyone in our government who worked hard to keep Americans safe deserve all of the thanks in the world for taking that on behalf of all of us. But with hindsight being 2020, is there anything you think you would do differently? It does strike me in trying to figure out how to cover this, that if we do face another pandemic, it's going to be a serious crisis of trust in the people that are going to be trying to battle it in the types of roles you and Dr. Fauci held in 2020.
Because we didn't address community issues. And we learned that in HIV. This is what bothers me, because Tony and I and Bob all faced HIV and understood the way you battle and the way we're controlling HIV without a vaccine is working with the community and listening to what they need. And still, we're not listening to their concerns and saying, this is a study that addresses that, or we don't have the study that addresses that, and we're going to get the information because we know it's important to you. We can't ignore people. And when you ignore people and they get pushed to the side, they even got more vehement because they know they're being ignored. When you look at what happened in rural health, people died in rural communities because they've been dying at 20% higher rates across all diseases for more than a decade. They know that. They know that they've been ignored from the healthcare system. So these are the kinds of things that we have to address to rebuild trust. It's not going to happen as a one-off. It's going to happen as a continuously listening, not sitting in Atlanta or Washington, but getting out in the communities and listening to their concerns. If we do that.
You think you did enough of it in 2020?
Well, it's why I went out state by state, because what was, I think, not appreciated is amazing things were done. And we're not capitalizing on that. We're not capitalizing on the FDA nimbleness and really creating that as a future pathway. We're not capitalizing on bringing the private sector to all pandemic preparedness, because they're the ones that brought us tests. They're the ones that brought us treatments. They're the ones that brought us vaccines in a very quick period of time. But we haven't onshored our active pharmaceutical ingredients. We're still very dependent on elsewhere.
You mean that we don't make the stuff that goes into our drugs here in America? Sorry to translate
this. Yes, absolutely. Thank you. We're not onshoring critical, essential medicines that can protect American people.
Yeah. So while I have you, can I just ask, and again, I'm sort of thinking about how does this look if we potentially face another pandemic, which I know, again, everyone in this system is constantly preparing for. We're seeing a lot of concerning reports about bird flu at the moment, the outbreaks in cows leading to tests in milk. I'm getting questions from my friends who are also moms. Is this safe? Is it not? What is the level of concern right now about that potentially becoming a pandemic?
Well, thank you, Casey, because this is why I'm really concerned, because we're making the same mistakes today that we made with COVID.
Okay.
And what do I mean by that? We're not testing to really see how many people have been exposed and got asymptomatically infected. We should be testing every cow, weekly. You can do pooled PCR. We have the technology. The great thing about America is we're incredibly innovative, and we have the ability to have these breakthroughs. We could be pool testing every dairy worker. I do believe that there's undetected cases in humans because we're once again only tracking people with symptoms. When we did that with COVID, the virus spread throughout the Northeast undetected because it took a long time to get to the vulnerable individuals. But in the meantime, thousands, hundreds of thousands of people were infected with asymptomatic or mild disease and never came to medical attention. We have to switch from symptoms to actually definitive laboratory testing. We have the capacity to do that today, like that.
All right, well, that's cheerful. I don't know exactly what to say, but it does. There's so much that happened that we saw play out in 2020 that I think is going to matter in terms of the future. And you're right that we learned a lot as well in terms of that PCR testing. Dr. Birx, I'm very grateful for your time today.
Thank you
very
for
much for
having
being here.
me on.